asking about demographics of this case, but can you say whether this child was vaccinated or not, given the importance being placed on vaccination in this age group?
It's a good question. We're still working on completing our investigation, and that's one of the issues that we want to verify is whether or not this child was vaccinated. So at this point, I can't answer that question, but it is something we are going to try to verify one way or the other.
Thank you. Now to Kent Wainscott from WISN TV in Milwaukee. Kent.
Hi, thank you. Kind of a two-part question. One is, I know you mentioned you're going to still continue to analyze the data, but are you seeing an increase in severity of these cases in children? And the other COVID-related deaths in young people, were they also cases of this multi-inflammatory syndrome?
In answer to your second question, no, we only have had the one fatality due to MIS-C. But your first question, we are continuing to monitor. Could you just repeat that first question again, Kent?
Yeah, I just wondered whether these cases of MIS-C are showing up as more severe than they had previously during the pandemic.
I can't say that, no. I mean, it's been pretty consistent throughout the pandemic, you know, of how sick some of these kids are. About 60% of our cases actually need to be admitted into the pediatric intensive care unit. Many of the children are suffering from cardiology problems, gastrointestinal problems, just it's across the board. I can't say that this has been more severe at this particular time. There is literature out that is suggesting that the Omicron variant is not as serious as far as the illness goes, and that would go certainly hold true with MIS-C as well. But again, we just need more data, keeping in mind that this is less than over about a year and a half old as when we first discovered the MIS-C.
Thank you, Kent. Now to Tiffany Olson from WKBT TV in La Crosse. Tiffany.
Hi, I'm wondering if, so the age group starts with age 3, I believe, for having this. What do you tell parents for the kids age 3 to 5 that can't be vaccinated?
Well, actually, the age groups start from the day you're born, I mean, up until 20 years old. In the press release, they mentioned that the majority of cases are between 3 and 11 years old. But for those parents of children who are 3 or 4 years old and cannot be vaccinated, we are strongly encouraging them to get the family vaccinated and friends. And we also want them to be very aware of the signs and symptoms of not only COVID-19, but also of MIS-C, which usually starts off with a lingering fever. And then that could go into chest pain, abdominal pain, some of which can be very severe and actually can mimic appendicitis. And also it gets into some respiratory problems where you have trouble breathing and you have trouble staying awake and being alert. Those are all signs, but the main sign that we want parents to know is if they have a lingering fever, where the or the fever lowering medications, Tylenol, whatever the case may be, you know, where they are not working. So we really are pushing vaccination for the entire family around that child who cannot be vaccinated.
Thank you. Now to Mark Johnson from the Milwaukee Journal Sentinel. Mark.
Thanks for taking our questions. When in the progression of COVID does this multi-system inflammatory begin presenting, and how do doctors go about treating it?
That's a real good question, Mark. Thanks for asking it. And again, the multi-system MIC starts anywhere from 2 to 6 weeks after a child has been exposed. During that original exposure, they may not have any symptoms, so they might not have any idea that they ever had an exposure to COVID-19. So again, it all starts with the progression where they get this fever and they have some of these other symptoms, as I mentioned, with the, trouble breathing or, failure to stay awake, failure to be alert, that type of thing, where they're sent into the hospital or into the emergency room where they are subject to many laboratory tests. The laboratory tests identify the inflammatory markers. It also will tell you if there's any problems or any inconsistencies with the cardiac, with the heart, with their kidneys, with their abdomen. It's a very, very complex test. Now, as far as treatment goes, there's about 3 things that can be done. One would be to put the child on some kind of a blood thinner, whether it be warfarin, heparin, anything like that, or in some cases with small children, they're on low-dose aspirin. It's also treated with steroids. And the third thing that is commonly used for treatment is prednisone. It's a steroid is prednisone, but also it's called IVIG. It's intravenous immune globulin. And that's something that's been used to treat similar diseases like Kawasaki disease. And so far it's been very effective, in the children that have received those particular medications and those treatments.
Thank you. Now to Eric Gunn from Wisconsin Examiner. Eric?
Are there particular risk factors that appear to be associated with an infection becoming MIS-C?
That's a really good question. And the answer to that right now is that we really can't identify a lot of risk factors. We are seeing that it has become more prominent in the Black children and Hispanic children. The numbers, even though the numbers are not as high as white children, the percentage or the cases per 100,000, if you want to, are much higher amongst Black children and Hispanic children. Now, what are their risk factors? That's what we're really trying to figure out. And that's why we are prioritizing getting reports in as quickly as possible and also to be as complete as possible. All of this information is shared with the team down at the CDC who's trying to put this together. But again, it's been very difficult to identify specific risk factors at this time.
Thank you. Now to Caitlin Schumacher from WBAY TV in Green Bay. Caitlin?
Hi, sorry, I just got a call from a source there. Thanks so much for doing this. My question to you is, we know this is rare. We know that only one child has passed at this time, but I guess, what would you say to parents who are nervous about this virus and this disease?
We want them to be aware of the best way to prevent this, and that again is through vaccination for anyone over 5 years old. It's probably the best way to do it, but what we really want them to be aware of is what are the main symptoms of MIS-C and what will trigger them to go to the emergency department, to the urgent care, whatever the case may be. And again, it's that lingering fever. Abdominal pain is very common. We're talking hard to breathe is another possibility. Chest pains, confusion, not being alert. We don't want them to have a panic and have every little sniffle be associated with MIS-C. So if we know more about what the MIS-C symptoms are, and we will try to make that message across to people that this is what could happen. This is when you need to see your doctor.
Thank you. Now to Jonathan Neiser from NBC 26. Jonathan.
Yes, thank you for the opportunity. You've answered many of the questions I had. Is there any way to clarify, did this death occur recently, or did it take a while for the DHS to confirm that this death was MIS-C and it happened weeks ago?
I hate to say the exact time when it happened, but it has been within the last month.
Thank you. Now to Jesse Geraci from Spectrum News. Jesse. Spectrum News. Okay, we're going to move on then to Ken Johnson from WDIO-TV in Duluth. Ken.
Hi, thank you. Do we know what kind of role MSIC plays in long haul COVID?
I see. We really don't know what the role is on that. It's similar to the long haulers in that it is a major complication of COVID infection, but it's really, I don't believe there's any relationship between the two.
Thank you. Now to Max Cotton from WEAU-TV in Eau Claire. Max?
Hey, can you hear me?
Yes, we can. Go ahead.
Obviously, MISC is pretty rare, but it's something that we've seen kids get.
Mhm.
Is there, other than those telltale symptoms, is there any way to detect it early? Is there anything early that that parents should be overtly alert for? And how long does it take to truly develop?
Well, again, it's a syndrome that happens anywhere from 2 to 4 up to 6 weeks after the initial exposure to the COVID virus. There really are no other tests that can be run. If the child is perfectly healthy, there's nothing that, and there's no reason for them to seek any medical care. There's no way of telling if it might be brewing and you might actually come down with it at some particular point. It usually has to result in, again, that lingering fever and some of the symptoms, taking them to the clinician and having these multiple laboratory tests done to identify when you are actually in that acute stage of MISC.
Now to Logan Rood from WISC-TV in Madison. Logan. WISC. Okay, so we do have some time, and because you were so patient as we dealt with our technical difficulties, we're going to go through and see if there are any follow-ups, and we'll just follow the list from the beginning. And we'll start with Mary Jo Ola from TMJ4. Mary Jo?
Hi, thanks. Tom, I don't know if you touched on this exactly, but can you explain what MISC does to a child's body when they contract it?
Sure. Again, it's inflammatory markers are the main source of what we see. And by that, we are looking at cardiac inflammatory markers, kidney inflammatory markers, gastrointestinal inflammatory markers. As part of the case definition, what we need to see is, again, increased inflammatory markers, but also multiple organ involvement, where there's dysfunction of the heart or the kidneys, or if there's abdominal situations. And again, abdominal situations are usually can be very severe, and some can actually mimic appendicitis. We're also looking at possible neural problems. It has to involve one of the at least two of the organs of the body with the high inflammatory markers to meet our case definition. Again, the vast majority are cardiac problems, what the children are seeing, which is why we have about 60% of our cases having to be admitted to the pediatric intensive care unit.
Thank you. Now, Shemaine Mills from Wisconsin Public Radio. Shemaine? Shemaine, do you have a follow-up?
Sorry, no, I don't.
Okay, thank you. Alex Moe from westbusiness.com. Alex.
Yes, thank you. You mentioned this condition develops typically 2 to 6 weeks after the initial exposure or infection with COVID-19. how long does it typically last following the onset of those symptoms that you've been?
I think you got cut off, but you want to know how long does the symptoms last? And it varies depending on the severity of the child. Hospitalizations in and of themselves can last anywhere from 2 days to 2 weeks or more. And there's always going to be some follow-up with that child, especially when it involves cardiac problems, to make sure that the cardiac system is under control and back to where it should be. We are doing follow-ups. There's actually a nationwide follow-up on some of these children to see how long these symptoms will last and to see how extensive cardiac problems can be and how they can affect the child's future. But the acute stage can be, like I said, just a couple days, or it can be up to a couple weeks, depending on how severe the child is.
I think he also asked Tom about from exposure to onset of symptoms. How long that can take.
Yeah, and the exposure to the onset of symptoms would be, again, somewhere between 2 to 6 weeks following that initial exposure.
Thank you. Now to Gabrielle Mays from Fox 6 in Milwaukee. Gabrielle?
I'm good, thank you.
Okay. David Wahlberg from the Wisconsin State Journal.
Okay, quick clarification of what you said before. Is this new death one of the 2 already reported under age 10, or would it be the 3rd?
I believe it'd be one of the first 2. I can't verify that for sure, though. I'm not positive which it is, but I think it's one of the 2.
Kent Wainscott from WISN. Kent?
Yeah, hey, Tom, if it's 2 to 6 weeks after exposure, that's kind of right in the wheelhouse of when we were seeing such a huge surge in the Omicron cases. Are you anticipating a large increase in the number of these MIS-C cases as well?
That's an excellent question, Kent. And the answer to that is yes, we are probably going to be seeing more cases. We have been seeing more cases since the 1st of January. We've had 33 cases, including 23 or 24 cases in January alone. And here we are halfway through February, and we continue to see a high number of cases. And we anticipate that that's going to be lasting for a while.
Thank you. Now, Tiffany Olson from WKBT in La Crosse. Tiffany, do you have a follow-up? Again, Tiffany Olson from WKBT. Okay, we'll move on then to Mark Johnson from the Milwaukee Journal Sentinel. Mark, a follow-up?
Yeah. How well do we understand the mechanism that the virus is going through, like what it's actually doing to cause COVID to become MIS-C?
Well, again, we really don't know what the mechanisms are for that, and that's one of the main reasons why we want prompt and prompt reporting, and we want accurate reporting, so we can share this with the researchers down at the CDC. Really can't answer that question right now, but that's one of our goals, is to really figure out why this is happening and what the mechanism is that's causing, this virus to cause the complication of MIS-C.
Thank you. Now Eric Gunn from Wisconsin Examiner.
Has there been enough data generated nationally or even globally to sort of fix a particular death rate for this condition?
Well, I can tell you the deaths due to MIS-C nationwide are very rare. Wisconsin's case was number 60 total. There's probably been about 7,100 confirmed cases of MIS-C nationwide. So 60 out of 7,100, I'm not going to do the calculations for that, but the death rate seems to be very low, and we hope to keep it that way.
Thank you. Caitlin Schumacher from WBAY-TV in Green Bay. Caitlin?
Good, thank you.
All right, thank you. To Jonathan Neiser now from NBC 26. Jonathan?
Thank you. No question.
Thank you. Now to Spectrum News. Jessica at Spectrum News. And she put a question in the chat. Her question is, this is happening most often to kids 3 to 11. What is the message to people with kids over 11 years old?
I think it'd be the same message to them as well. You know, the best way to prevent it is to prevent getting any exposure to COVID to begin with, and that's through the use of vaccinations. Again, the same with the parents as the older children versus the younger children, knowing what the signs and symptoms are of potential MIS-C, lingering fever, abdominal pain, shortness of breath, confusion. That's when they have to really be concerned and get their child to a medical provider as quickly as possible.
Thank you. Now to Ken Johnson from WDIO-TV in Duluth. Ken, do you have a follow-up?
Yes, thank you. In relation to, ICU beds being filled up, do we have enough resources to potentially treat MIS-C in the future?
Yeah, I believe we do, and again, as long as it continues to be a relatively rare condition, and that's what it is currently, I think we are going to be okay as far as having enough beds to treat these children.
Thank you. Now to Max Cotton from WEAU-TV in Eau Claire. Max, a follow-up?
I got nothing.
Okay, thank you. And finally, WISC-TV in Madison.
That question was already asked.
Yeah, there really isn't. I mean, just to reiterate how we make this diagnosis, again, it's based on, inflammatory markers and multiple laboratory tests to test for organ dysfunction. So there's other conditions, one of the rules that we follow is if there's another plausible cause for this, other than COVID, it would not be considered a case of MIS-C.
Thank you for that. And with that, we will conclude today's media availability. Again, our thanks for your patience as we muddled through our technical difficulties. We would like to thank Tom Haupt and all of you for participating. For more information about MIS-C and COVID-19, you can find those on the DHS web pages, and any additional follow-up questions can be sent to dhsmedia@dhs.wisconsin.gov. Be safe and have a good weekend.
Thanks, everybody. Stay safe.